Centers for Medicare and Medicaid Services have approved another state waiver request to put work requirements in a Medicaid program. This time it's in South Carolina. And the CMS Administrator, Seema Verma, actually made a trip to South Carolina for this announcement because it's a waiver request that's a little bit more robust than some of the other states have asked for. It would actually impact low-income parents for the first time of any state Medicaid program. This approval from CMS went to the state of South Carolina on December 12th. It was in response to the state's Section 1115 Medicaid demonstration waiver. That's the mechanism that allows states to include things like work requirements in their Medicaid program should they be approved by the federal government. In the state of South Carolina, it's the state's Healthy Connections Community Engagement Initiative and Palmetto Pathways to Independence initiatives that are part of this work requirement feature. It imposes an 80-hour monthly work requirement on the low-income individuals of the state. It comes with a modest Medicaid expansion. South Carolina is not one of those states that had expanded its Medicaid program, so the majority of individuals that receive Medicaid in the state are parents or children. It does not require children to work, but we'll talk about how it will impact them in just a moment. The governor of South Carolina said, in this economy, there's no excuse for able-bodied adults not to be working. A lot of health policy advocates and health researchers have countered that, saying we know what the research shows, that first of all, a lot of Medicaid recipients are already working, and in fact, imposing work to get healthy is the opposite of what actually works in a society. You need to get healthy first to be able to join the workforce. Roughly 80,000 parents already qualify for Medicaid in South Carolina. They are the ones that will be subject to this work requirement. Now, what's next for the state of South Carolina? A lot of folks are already looking at litigation, and that would not come as a surprise because work requirements in other states like Kentucky and Arkansas are already working their way through the courts and are at the appeals stage. Now, we said we would talk a little bit about the impact of work requirements of parents on what actually happens to their children. And this, like we said, is not a work requirement on children themselves, but it does impact the children. There is a body of research that shows that when you, first of all, impose this kind of requirement on parents, they're going to be expected to lose coverage. This is a pretty high bar for a lot of parents to try to maintain 80 hours a month of work. A lot of people who are already working would probably also lose coverage because of the reporting requirements. We've seen this in other states that more people lost coverage because they couldn't report that they were working, not because they weren't working. Now, we also know that when one family member is uninsured, that leaves the whole family, including the children, exposed to risk and medical debt. And we have a body of evidence over the last several decades that show us that children of parents who lose coverage are more likely to become uninsured too. We also know that even insured children of uninsured parents don't make it to the doctor. Uninsured parents don't take insured children to the doctor like they should. History has taught us this. So this is South Carolina moving in the exact opposite direction. We will keep you posted as this works its way through. We know this is not the end of the story. This is really drastic measures for the state of South Carolina, most likely to save a little bit of budget money along the way, and to stick to the political ideology that we've been seeing coming out of CMS. We link in the description below to South Carolina governor's announcement, to the CMS waiver approval, and to some of the other press that's been coming about this decision. Now, make sure you like this video and subscribe so we can keep you posted as this likely makes its way through the courts.